Welcome, tribe, to the Thrive Right for Life podcast. I'm her co-host, Professor Reed.
AKA
Lit.
Lit. And I sounded ghetto.
AKA.
Lit. And I'm his co-host, Dr. Keisha Russell. So this is kind of an impromptu episode
Yeah.
where we're just throwing it out there. So a little disclaimer. Obviously, neither of us are MDs, right? So medical doctors.
No,
right?
I only have a master's in English.
I am a doctor of sports medicine, right? So all of this knowledge is what we research when we talk to experts, when we talk to individuals in the field. So by all means, this is true factual information, but we just have to throw out the disclaimer.
Doctors, and you
Right.
should get medical advice from your doctors. We are just throwing out information that we found
Yes.
readily available through various media sources.
Including Centers for Disease Control, there's National Health Institute, there's a World Health Organization. So we're getting these from individuals who are physicians in these organizations.
Yeah, they have credibility.
Yes, so it's credible sources. But I've had a lot of individuals ask us, can you do an episode on this? Because there's so much confusion, there's so much paranoia. There's
a lot of fear going around right now for this
yes.
COVID-19, aka coronavirus.
Yeah.
And it's affecting everybody. You know, you go in the grocery stores, none of the supplies are available.
And those individuals, I'm sorry, you don't need 5 big packs of toilet paper. People like me who are actually running out of toilet paper at home kind of need some of that toilet paper. So it's a little frustrating to try to go and get something simple.
It's almost like everybody's doomsday prepping at the same time.
Yes.
And I don't think we should.
And I'm curious with all this doomsday prepping, because it can be expensive. I hope people are going to be able to pay their bills.
Yeah, we want to help you thrive for
your life. Yeah, so we want to kind of dispel some of the myths that are going on with this. And I've heard so many theories that it came from snakes. It came from someone eating bats. It came from...
I heard once you come in contact with it, that's it. You're going to drop dead. Just say your last goodbyes. And I was like, whoa, is this...
No.
What are we dealing with here?
No. So let's jump into some of the history. I mean, we're going to give you some preventative tips and things. Yeah, which, by the way, again, we got this from the CDC, World Health Organization. So these are credible sources in our country who are telling us this is how you prevent it. This is how you can help yourself with it. So a little bit of history. Coronavirus has the first actual case the recorded case came about in 1949. Jeez. So this stuff's been studied well studied since the 70s, easily since the 70s. So there's different strains of coronavirus, which I'm glad people are getting apt to, that there's different strains, because it's important to know that there's different strains. And the COVID-19, that's just a new strain. Okay. And one word that I want to clear up is the word pandemic. Because when you hear pandemic, what do you think?
Epidemic, pandemic, any-demic.
It's the end of the world, right? But the actual definition for, or the meaning of pandemic is it's a virus that transfers from an animal to a human. If it's an epidemic, it's something that transfers from human to human. So where media is taking these terms and throwing it out there, and a lot of our society doesn't know what they mean. We just know it sounds scary. Like that patient I had where she had a contusion, and which is a bruise. It's a medical term for a bruise. But me being in the role of trying to get things done, I just let her know, oh, yeah, it's a contusion. And I went on with my stuff. But I forgot that she doesn't know what that means. And to her, that word sounded so scary. And she thought that she was just going to be out of her sport. She was going to be playing anymore. But so it's helpful to clear up some of those things.
And I heard a story, recently. I don't know his name, and I don't know that I should say the name of the hospital, so
we'll leave that out. Yeah,
the fella was coughing repeatedly, nonstop, really loud, really hard, and everybody jumped to conclusions and said it was the coronavirus. So they had to test him, and no, he had whooping cough.
Yeah. So I mean, there's a lot of misconceptions, and another one is it's a virus, not a bacteria. So there's people saying you need antibiotics, you need antibacterial. It's a virus. You have an immune system. They operate a little differently. Yeah, they operate a little different. We won't get into all the pathophys, but it does operate a little different. The most common types of human coronavirus that we've seen is SARS and one called MERS, which exploded in the Middle East in 2012, but 2014 was when it really gained some media kind of light on it. So we know we've encountered this before, and there is a coronavirus, a strain that is essentially a common cold. Okay. So the CDC let us know that the likelihood of you having had coronavirus as just a human in the U.S. is extremely likely, but it's just not the COVID-19 strain that we're seeing.
So you could have already come in contact with it and already beat it, and your body already dealt with it, and you didn't know.
Yes, and early on when this whole thing started to explode, there's a physician that got on YouTube that pretty much let people know. He's like, I am a medical doctor, and this is the research, and the likelihood of everyone pretty much having ran into a type of coronavirus is extremely likely because coronavirus runs in humans, but I also found studies where it shows it runs in feral pigeons and mice and rats and pigs and ferrets and
so we may have
all kinds of animals.
Consumed it.
Right, depending where a lot of people are thinking why it exploded in China is because their delicacies are all kinds of different animals. But what the research says is we really don't know the cause of it. We don't know exactly where the source is. And that's why they're quarantining people, is because they're trying to figure out exactly where this is coming from instead of allowing it to spread. So it's just our government trying to be responsible in terms of not allowing people to just frivolously get sick. Panic. Exactly. But I think that's where a lot of people are doomsday prepping, is because like, well, if we have to be quarantined, or if my neighbor gets sick, or if this happens, when, I mean, if you're healthy, you have a good immune system, you're not a small child, and you're not an elderly individual, the likelihood of you being fine. And we know that research is showing us that there are some cases of death, about 3,600, but there's 60,000 cases of people that have recovered from a form of corona. That's the part
that I wasn't aware of. When you told me that, I was like shocked. I haven't heard anything about anybody recovering. So it's like they've only pitched the fear part. They haven't explained that people have recovered. I thought it was an automatic death sentence. As soon as that's it. I'm like, what?
Absolutely not. And we've seen, at least in California and Washington, the individuals that have unfortunately passed, those individuals were over 60. They already had compromised immune systems because they had heart conditions, they had respiratory conditions. And we've seen with the coronavirus types, whether it's the COVID-19 or the SARS form of coronavirus, right, that it attacks the respiratory system. So if you're vulnerable to respiratory infections like our small children are or elderly are, then yes,
or if you're already dealing with pneumonia or something.
Yes, or if you have some sort of autoimmune that attacks your lungs or something like that, then obviously take precaution. We all should really take precaution just generally, whether there's a COVID-19 outbreak or not. But there's individuals that are getting really hyped based off the news media headlines.
What I do like is the fact that people are actually starting to like wash their hands more now. Because
now
I can't tell you how many times guys walk out the restroom and I'm like looking at them like,
I've seen grown individuals do what they do, come out, head straight to that door, and I'm like,
oh, wash
can you
your hands?
Even though you feel like maybe you didn't get anything on your hands, still you're in the vicinity where other people have gone, and like you should still
wash your hands.
It's just good practice. Right. And we know this dates all the way back when nurses were helping women give deliveries. They weren't understanding why high rates of women were dying until one woman decided, well, what if we washed our hands? And literally, as soon as they started washing their hands, the rates of women and babies dying due to infection during childbirth drastically decreased. And that's when the whole medical community started picking up hand washing.
And then us as humans, we touch our face so much. I probably touched mine 2 or 3 times. Look.
Without even realizing it.
You do want to have clean hands in case you have a little piece of lint or hair or something tickles you. You got to touch your face. You have to address something to your eyes, your nose, your mouth.
And that's to prevent the spread of influenza and prevent the spread of hepatitis and like anything that we can come in contact with, anything that can live on these surfaces.
And just off the cuff, this is a time where a lot of us have beards now. So you fellas out there, the beards weren't in so much a few years back. Guys used to always shave your face all the time, and for interviews always be shaved, and military
That's
practices
true.
and
Yeah.
stuff. But now that beards are becoming more popular, make sure you wash your beards too, because they hold a lot of
yeah, even just food.
Right, yeah.
Even just food. So we talked about SARS versus MERS, common types of coronavirus. One is called, and I have my notes just so I'm not misquoting anything, COV-OC43 and 229E. That's literally the common cold. So signs and symptoms, runny nose, headache, you don't feel good. That's a form of coronavirus. So hopefully this gets people to get into the mind frame to understand that they've ran into some sort of form. The likelihood of them having ran into some sort of form is likely. So this whole fear of everything really is just unnecessary media-driven fear to get you to go purchase things you really don't need.
Misinformation or lack of information has always been a problem, because it does state most people get infected and have been in contact with it in their life. Like, this isn't new. Yeah. I thought it was just brand new. It started yesterday, and boom, you're dropping like a fly as soon as you come in contact with it.
Yeah, no, this strain itself is technically new. That's why it's a new coronavirus. But in terms of coronavirus as a whole, there's a lot of different strains. Yeah, there's been so much that's been studied on it.
But then I don't watch news as much as I probably
I don't ever watch news. I don't ever watch the news, because if you look at some of the news headlines, it's
just you wake up and you're in fear the rest of the day.
Death. But they're not telling you that.
So I wasn't informed. I didn't know about this thing.
Yeah, they're not telling you that the individuals that have died had compromised immune systems. They had other issues.
They didn't tell us that people have recovered.
Yeah, absolutely. And the individuals, let me go to my notes. Active cases, about 42,000. There are total cases around the world with like some form of coronavirus is like 106,000. But again, we have 60,000 of them that are actually being cured. We have a very few amount of them, unfortunately, who have passed from it. But when it comes to the flu, there's many more deaths and cases of the flu, of influenza, something that it's just kind of clockwork now for us versus what's actually happening with this coronavirus. So is it something we should be aware of? Absolutely, yes. But is it something we should be scared of? No, because there's things that we can do to help put ourselves in a better situation so we can prevent ourselves from coming in contact with someone that may have it. And we know that travel and stuff has been stopped because anyone coming from China, I was just told that Italy has completely stopped all travel in and out.
Wow.
So they're really locking it down. But again, that's a responsible government.
It's a precaution. So you can't knock them for it.
Just taking precautions. So when it comes to the COVID-19, what are some of the signs and symptoms that we're seeing with that?
So most people get infected with human strains of corona at some point in their lives.
Mm-hmm.
Wow.
Yeah.
I didn't know that. And those symptoms are runny nose, headache, cough, sore throat, and fever.
Which is pretty much the common cold.
We've all
or flu. Yeah, what we've all come in contact with.
Right.
So in terms of prevention, there are ways that we can prevent ourselves from getting it. And one huge one is from the inside out.
The diet.
Yes. So what is your lifestyle like? What are you actually eating? How is your immune system?
Because you have different diets. Like, let's say your diet is really poor, and then now you have a acidic environment in your body, and now you have more mucus. So once you have mucus and a high level of acidity, that's kind of like a breeding ground for disease, yeah. Bacterial infections.
Your body is not in balance.
It's not in balance. So
exactly.
We might want to up the veggies, up the alkalinity,
decrease the alcohol, because we know that can mess up our immune system, especially in times of high stress. So if you're extremely stressed out,
I think this is kind of a time of high stress.
Yes, which media should be helping us, and it's not helping us. It's just stressing people out.
Prep.
Exactly. Prep. Spend all your money in prep, right? So obviously the CDC and the World Health Organization says that hand washing, hands down, number one way to help prevent.
Man, and I think, we got to remember to disinfect doorknobs and light switches and steering wheels and cell phones.
That's a huge one that people don't think
gas
about.
Pump. After you pump the gas, it's touched by everyone.
It is. And not saying you need to live in an absolute sterile.
Money.
Oh, yeah. And not saying you need to live in an absolute sterile environment.
No, because...
But if you're going to come in contact with those things often, then it's good practice to not just go from your cell phone that someone else borrowed, who they may not have washed their hands in the bathroom before they borrowed your cell phone, and then going to the gas tank, and then or going to the gas station, and then going to eat some food or making a sandwich for your kid. Like,
wash your hands, disinfect your hands, sanitize your hands.
Yeah, you should have some sort of hand washing.
We touch a lot of nasty things throughout the course of the day.
And don't even realize it because it's just part of our normal everyday.
But the flip side to that is, doesn't it build up your immune system?
I was going to say, so not needing to be in a sanitized environment, because coming in contact with different bacteria, because there's bad bacteria, there's good bacteria, right? So we need that to strengthen our immune system. That's one reason why individuals believe so much in vaccines, is because you're being introduced to this virus, so your body can build up its immune system against that virus.
That reminds me of like the phase you go through when you have your first child. You try to make everything like a clean room. You don't want them exposed
Mop 3
to
times a day.
But after the second and third baby, you're like, wait, no, they need germs. It's okay.
like they drop a grape on the floor and parents are like, no, don't eat that.
Oh, no, you got the 5-second rule. Or 3-second rule.
A little bit of dirt never hurt anyone. Now, if you're taking down gallons of dirt, obviously it's probably not good. But yeah, we need to be a little dirty sometimes.
3-second rule is okay sometimes.
Right, yeah. But again, if you have a compromised immune system, probably don't eat that grape. Yeah, probably don't eat that off the ground. You need to strengthen your immune system a little more first in some natural ways versus just eating a bunch of dirt.
Practice germ balance.
Exactly, right? So how you wash your hands, this is really important because people don't know how to do it. I see people just wet them in the sink, blah, blah, take off, right? So really, you should wash your hands for at least 20 seconds.
Okay.
So you can sing happy birthday to yourself twice. You can do the alphabet forward and backwards. Whatever you need to do.
Methods like that, huh?
Yeah. That's what I teach the little ones, is sing happy birthday to yourself.
I just assume 20.
Yeah, or you can just simply count to 20, right? But that's scrubbing with soap and warm water, right? And then rinsing them off, making sure to dry, turn off the faucet with your paper towel or whatever you have. And then please don't touch that germ-ridden knob as you leave.
Yeah, it's a good practice in those public restrooms to already have your paper down some.
Yep.
And so once you wash, grab the paper, turn the faucet off. I open the door, then drop it in the trash can, prop the door with your foot, make sure you don't touch anything, then head out. That's kind of the method that I use.
Oh, yeah, absolutely, which is a really good method, right? And also, everyone has those water bottles that they carry around. Please wash your water bottles, because a lot of people, they'll keep their water bottles for weeks on end going without having ever washed it, and it's sitting on the ground, it's touching other people's hands, it's you touch something, then you touch your water bottle, right? So just sanitizing, and cell phones is huge. Just take a wipe down your cell phone, because they've actually done studies on cell phone. This is kind of gross. They found levels of fecal matter on people's cell phones.
Wait, how'd
and
they
like
get
the
there?
earbuds. People take them in the bathroom with them. People are on the toilet on the phone. So when they go to wipe, they touch their phone to set it on the counter. Then they may wash their hands, but
you see the dismay on my face.
Yeah, but also people, hey, my cell phone's dead. Can I borrow your cell phone? Right? What did I do in the bathroom? How have I washed my hands? How have I been clean? Right?
Fecal fingers.
Plus, if someone's talking on the phone like this, they're spraying all kinds of stuff onto the phone. You know, so really just being conscious and disinfecting our stuff. All right. I mean, obviously avoid touching eyes, nose, mouths. That's a big one. Cover when you sneeze.
When I went to that event this weekend, right? There was this young lady walking by, and she did the biggest sneeze I've ever seen.
Just out, right?
Girl didn't cover anything.
All bad.
I literally was grabbing my kids and trying to let the mist. Come on,
gosh.
don't cover
Just
up.
Be responsible.
And other people were ready to jump down her throat,
are you kidding? Especially now,
yeah.
Yeah.
You know, sneeze.
Yeah.
And not. Go
but
inside,
people aren't taught. Yeah, go inside your own shirt or something. I
Something.
consistently do that because you know how far it can spread.
Yeah, don't try to water the earth.
No, not needed. Obviously, avoid contact with people who may be infected.
Right.
That's a big one. A couple natural ones I wanted to throw out there. Vitamin C shots in the morning. Yes. And we know vitamin C helps to strengthen the immune system, but it's a preventative measure. It doesn't work very well. Studies show it doesn't work very well once you're already sick. So I know people start to get the runny nose and stuff, and they're like, oh, emergency, or I need vitamin C, I need oranges, I need lemons. It's already a little too late. Your body just has to kind of go through the courses.
Helps. I'm a
it doesn't help
C
to
crammer.
It doesn't help to progress it any faster. I mean, it may help with your symptoms or make you feel better. So absolutely, yeah.
That's what I mean. Then symptoms, maybe not necessarily the actual virus or bacteria that's going on, but the symptoms. I think I felt a little better.
But I will tell you from firsthand experience, this past flu season, and I'm not one to get flu vaccine. I personally don't find it beneficial or necessary.
No, I don't either.
It works less than 50% of the time, anyways, for most people. And most people just get sick. So what I do is in the mornings, I'll take a little shot, literally like an ounce of lemon juice. I'll just take that back. I had students coughing and hacking, faculty, all kinds of things all around me, and not one single symptom. I was good. And that was the first flu season I actually did that with. And granted, I think the last time I got sick was really food poisoning. It wasn't even like an illness. But I was perfectly fine. And people were like, nope, you're going to be the next one. You're going to be the next one. No, I'm not. And I was perfectly fine. So just that little vitamin C shot in the morning can really just help you.
Yeah, I just ordered that immunity too.
That immunity is good though. I have to admit, that is really, really good. And then another one that wasn't really mentioned was sleep.
Oh.
And we know that sleep's super important.
Back to the importance of sleep.
Yes.
Okay.
We know that sleep's super important for the immune system, especially if you do get sick. Sleep's super important because that's when your body's healing.
All those repairs take place, all those processes, and I'm telling you, the body naturally wants to heal itself.
Exactly. And another one I put, don't stress. That's a big one because we know stress can lower the immune system and it can make you a little more vulnerable. So
stress is...
Meditate, relax. Go for a walk, right?
Relax.
Wash your hands for 20 or 30 seconds.
Find that place of euphoria for yourself.
Exactly. Some treatments, though, if you do happen to find you're getting a runny nose and things like that, really the biggest thing that the CDC recommended was humidifier or hot shower and take pain meds for your headache.
I haven't had a humidifier in front of me, oh my gosh, since a kid.
I use my aromatherapy every night.
Yes, that's...
And it's gorgeous. Man. It just really sets that ambiance and that mood, especially going to sleep. It just sets that whole, like, my mind's like, it's time for sleep.
That's the way to do it.
Right? So, that is all I have.
Listen, we just don't want everybody to stay in this panic and be uninformed.
No.
Because I was uninformed. I came over here panicking to her. Like, hey, what is this? She's like, chill.
Relax about it. We went through it with SARS. We went through it with what is it called? I can't remember.
Is
what
that
it's called
where
now.
they had that staph?
The MERS.
MERS was that?
In the Middle
MRSA
East.
Or something, or?
MERS is different. That's a staph infection. But no, MERS in the Middle East. We've been through it before. Even slightly with Ebola, like we've been through this before. So relax. Just utilize those tips. Prevention's huge. Just make sure your immune system's strong enough to be able to battle whatever you come against.
Everything you can do to mitigate the damage of this thing spreading and becoming detrimental to you. So the way you eat, the way you wash your hands, the way you sleep.
Yes.
Your hygiene, the way you wipe down the items you touch every day that you don't think about wiping down. Even keys. I mean, just cell phones.
Just take care of it.
Take care of it.
We want to thank you, Tribe, for joining us for this kind of special episode. We definitely want to thank One Shooter Production for helping us out with all of this.
Check them out on YouTube and on Instagram.
Absolutely. And we'll see you next time on Thrive Right for Life.